Hello, Adab, and Assalamu alaikum. Welcome to another episode of Doctor's Couch. I am Dr. Rahman, your host and host of the show. Today is a very exciting day for me. Today, the topic is addiction in youth. Youth is very important for us, our future, our backbone of the society. Unfortunately, they are facing challenges with addiction and illicit substances. So today, I am joined by my two esteemed guests. My first guest is an addiction medicine specialist, Dr. Zishan Khan. And my second guest is an Islamic scholar and a speaker, Imam Sajid Ali. He's an Imam of Aubrey Masjid. Welcome to both of you. So, if that's okay, let me start with you, Dr. Khan. Myself, as an emergency medicine physician, I see a lot of cases of addiction overdose in my ER. And most of the time, they present like in a more severe format or more severe condition. That makes me concerned. Is happening more and more in the youth, and youth is the future of our society. And once I see them involved in such a bad condition or scenarios, that makes me concerned too. So, as a specialist, as an addiction medicine specialist, how would you like to define what an addiction medicine is and what chemical dependency, just for the layman?
Sure. Yeah. First of all, thank you for having me, giving me the opportunity to speak to our community on this platform. This is really, really important. So, Jazakallah khair for that. So, the precise definition of addiction is it's a chronic medical condition involving complex interactions with the brain, genetics, environment, patient's life experiences. It leads to a compulsive behavior, which, despite its harmful consequences, the patient keeps repeating itself. Yeah.
Got it. So
So,
it's more kind of like intentional, unintentional. Initially starts off kind of as an habit, and then once you're getting addicted or used to it, now it's kind of becoming more unintentional, and you try to repeat it without a conscience. Is that correct?
absolutely. Actually, you nailed it. So initially, of course, it might start as a recreational use,
Right.
or it might just start off as, the patient might be just taking the prescribed opioids, for example,
Right.
hydrocodone, oxycodone. So she doesn't know that, she's taking it or he's taking it, and they become dependent on that physically, psychologically, and then it starts to have its consequences because of its complex interactions with the brain chemicals.
And just the last point to it, and that's the same mechanism or the same behavior both in adults as well as youth.
That's true. Absolutely. Yeah.
Got it. So let me switch to you, Imam Sajid. So it's always brings me curiosity to know what Islam has to offer, or does it accept addiction issues as a problem, or does it give like any option that is it legal, illegal in modern terms, if I use the terminology, or if it's a permissible or totally prohibited?
Mhm.
So your take.
Yeah, Jazakallah khair for having me, Daksab. Before I kind of answer your question, so to answer your question, when it comes to permissibility of what we would term as an intoxicant, something that uh, kind of influences, it impacts the mind, right?
Hmm.
That is something that Islam defines as a muskir, which is an intoxicant that overcomes the mind and starts impacting or deters, and it bothers and it messes with the mind in essence. And so, by that definition, Islam would make anything that is qualified as a muskir, as an intoxicant, impermissible. And this is in line of the impermissibility that the Quran states in terms of alcohol, khamr, right? Something that is, and oftentimes people say alcohol, right? We kind of limit it to that definition of alcohol because the Quran talks about alcohol. However, what we find is the underlying reason why alcohol is Allah says it's a muskir, it's an intoxicant. It overcomes the mind, and therefore it hinders and it inhibits people's ability to think, behave, and all of that. And not only that, but also your relationship. It becomes a barrier between your relationship and your spiritual connection with God as well, with Allah subhanahu wa ta'ala. And so for those reasons, anything that is an intoxicant or has that effect
Hmm.
would be impermissible according to the Sharia.
Got it. So anything doesn't necessarily have to be alcohol. It can be any new innovation. that is making you from a normal person to a different person, which is not you in an actual sense, is not permissible in
Yes.
Islam.
Yeah.
So again, dealing with the recent or a modern problem, I would call the addiction in youth or addiction in general population. So in the last 1400 plus years,
Hmm.
has Muslims dealt with any similar problems? Like apart from like alcohol addiction, has there been any substance abuses in the past, or if there was any in the historical sense,
Yeah.
how they have dealt, and what's are there like any guidelines by the religion itself?
Sure. Yeah, yes. So Islam is a faith that has a judicial element to it, right? Within our faith, we find a judicial element of our tradition. Alhamdulillah, it's not
Hmm.
just a spiritual ritual religion. There's a judicial element to it, right? So there's accountability, punishments, whatever you may want to call it, for certain crimes that are committed, and intoxicants will fall under that judicial accountability for people that indulge in
Got
these
it.
these intoxicants, and so that serves as a deterrent. Now, how do you approach it? Has Islam dealt with it because of it being such a deterrent? Generally, for the most part of that 1400 years of Islam, I think the deterrents were so stringent, and even the societal pressure, the stigma against consumption of intoxicants was so stigmatized. It was so
Got
strong.
it.
It served its purpose very well. But yes, of course, now as those kind of get
Those rules are getting
erode, yeah, those kind
relaxed.
of erode away, those that social stigma around it. My friends and my peers aren't gonna criticize it as much. Society is not really criticizing it as much. So that's kind of now increasing. So now we are on the cusp of a ummah kind of where we're kind of realizing, no, this is starting to become a problem that wasn't as prevalent. And yes, it did exist even in the Prophet ﷺ's time, right? There was a companion, the narrations mentioned his name was Abdullah. Some say he was very comical. He would make the Prophet ﷺ laugh, right? And so he was sort of addicted in a sense, for lack of better words, to consumption of alcohol. But the approach of the Prophet ﷺ kind of sets a good framework of how we as a society or a family can approach that, where the accountability was there. Ali radiallahu anhu narrates that the Prophet ﷺ executed the punishment on him, which was the lashes in Islam. So it's a very strong deterrent.
Got it.
But at the same time, he was comfortable. What's kind of something to think about was that he was comfortable to kind of come to the Prophet ﷺ and confide, right? So the stigma, like the embarrassment, right,
Mhm.
wasn't there. He came to the Rasulullah, I've done this again and again and again, and he would get the punishment. But then one time the Sahaba kind of got fed up, right, and they said, Ya Rasulullah, this person, they kind of got frustrated and said, he just keeps doing this, and now he's being having to face the Prophet. So Allah's Messenger said, don't get mad at him, for he loves Allah and His Messenger, and they love him, right? So there's a very compassionate approach, right, to that. And I think that relational element, and Dr. Zishan can probably expound on that, I think is very vital. It's like, I think relationships, when it comes to addictions, is very important in terms of
Mhm.
not only getting to an addiction, but getting out of one as well.
Got it. So back then, initially, what I understand is like initially it was okay to drink alcohol in the
Yes.
early years of Islam,
Yes.
and then at somewhere in the middle, it got prohibited.
Yes.
So probably it was more difficult on them who were used to drinking to
Correct.
stop cold turkey.
Correct.
But in spite of that, they were so committed to religion, their faith was so strong that they did cold turkey. And
Yeah.
obviously, the example you mentioned of the companion Abdullah, it might took him a little longer because every individual is
Yeah.
different,
Yeah.
right? And I think the good part, what I feel that somebody who is very honest, somebody who is trying to give
Mm-hmm.
up,
Mm-hmm.
and in spite of knowing that there is a punishment
Yes.
attached to
Yes.
it,
Yes.
I'm sure, like, I mean, is there like end to the story? Like, did he
Yeah.
eventually give up, or
Yeah.
how it
Yeah.
ended?
The assumption from what the narrative says that he kind of came out of that habit,
Got it.
because he felt that kind of that connection. It was the relationship, the way the Prophet ﷺ dealt with them. He was like, I can't. I just there's a level of haya, which is a very real concept within Islam, right? This shyness.
Got it.
Like, this is the Prophet ﷺ, and he's dealing with me in this manner, and I just can't keep this up. But I wanted to kind of point out what you mentioned is like how the prohibition of alcohol was kind of introduced, Aisha radiallahu anha actually narrates a narration. She says that had it was gradual, he said, right? It wasn't initially instituted as it's impermissible. It was they would consume, then it was like when you come to prayer, don't be intoxicated. And then it became don't you cannot, it's unlawful to intoxicate yourself anymore. And so Aisha radiallahu anha says that. She said, had it been that Allah forbade that initially, right off the bat, right, in the pre-Islam era, that intoxicants are impermissible, she said people would have said, and this is her words, and she says people would have continued to indulge in the intoxicant, and they would have said, we cannot abandon it, we can't stop. And so the wisdom of the gradual forbiddance and prohibition of alcohol was actually intentional. We understand because the Aisha radiallahu anha says that, and she says even like other crimes or other violations. She said if it was not for them being gradually revealed, people would have said we can't, we just
Yeah.
can't.
Something that sounds very familiar in the modern treatment, what we use for alcohol addiction. And but to that, I'm going to come back a little later. Before that, Dr. Khan, I want to also kind of shed a light on the society, how we are evolving, right? So mostly in the past, we talked about alcohol addiction, smoking, tobacco addiction. But I think partly it's not to put the blame only on one side of things. If we look at the medical community, right? So over a period of time, kind of there is normalization, most of the states they have made it legal to prescribe what we call as medical marijuana, right? And now the CBD shops have popped up at every location like mushrooms. So for a society, for a youth, there is a void definitely for multiple reasons. And now, when you open up this channel or this new avenue, you cannot totally blame on them that now it's totally your fault. So, how would you see this? I mean, how we are kind of playing as a good and a bad actor of medical as medical professionals.
Yeah, that's a very concerning question, I would say. You go to a different state, you go to Oklahoma, and medical marijuana, it's no big deal, of course, it's legal. So you go to Washington State and California State, and marijuana is legal. Federally, it's illegal. So you're coming from Canada, legal. You're crossing the border, illegal. You're coming to Washington State, legal. So, the patients ask us, okay, what's right and what's wrong, right? Because we don't make the rules. So marijuana has its consequences. It's a substance, there's no doubt about it, right? Um, Even in the states in which it's allowed, I mean, there's data, the same scientific research applies, which like it's very concerning to me that like if mom uses it, the baby down the road can have a significant negative impact on the IQ of the baby. That's again uh, we take it or not, it's a
Right.
fact.
Exactly.
You can't really expect a person who is totally abusing marijuana, totally dependent on that, has been having consequences. Again, we discussed the definition of addiction. So if he is fulfilling the criteria of that, you can't really expect that person to be doing a white collar job or like in a high executive level position to be in the decision making. So we are losing that part of the community. Again, one person is part of the community, and the community is that's our future. So
Exactly.
it's really concerning. So I mean, I would say that legally, I can't really comment on that. But as a medical professional, of course, that's really concerning.
Yeah. So, as a medical professional who works day in and out dealing with all these different chemical dependencies, what are the few most common drugs? Because, like, when we do a drug screen, there are like 10 different drugs, right? And there are a lot more that are not in that screening process. And I see in the ER there is more evolving, like I would say almost every other day, what we call as street drugs or illicit drugs. So what do you see as like what are the top like few that are more challenging for you and what you are more concerned about?
Sure. So again, since the topic of discussion today is teenagers and youth,
Right.
unfortunately, 83% the times you will see marijuana. Teenagers, they abuse it. That's the most commonly abused substance. And for our viewers, they can actually look at the data, the National Center for Drug Abuse Statistics. And then comes other substance, hallucinogens. which surprisingly, it's in adults, it's not as common as it's common amongst youth. Again, as we know, hallucinogens, that's giving you a perception, false perception, whether it's auditory or visual hallucinations, things that are not there. Of course, illusion is, you see something and you think it's a snake instead of a rod. So, but delusion is a false belief. But hallucinations, it's just a false perception. So for some time, some period of time, you're just living in a false perception, and you're loving it because you're abusing it, and that's really, really dangerous situation, especially for our youth. So that's the second most common. Then comes benzodiazepines or tranquilizers or sleep pills, you can say. Those are the lowers. They decrease your respiratory, they induce respiratory suppression, especially if you combine it with the opioids, which is the next on the list. So you combine opioids with the benzodiazepines, end result is drastic, and that's what we are
Unfortunately,
seeing
I
now.
see this all the time, right? They were, I shouldn't say that they come in, they were brought uh, in kind of worse scenarios. Most of the time, they were not able to breathe, and we have to do some emergency interventions. And again, the way I started is more concerning because y on youth lies the future, right? I mean, as a society, when we are going to pass on to the youth, to the next generation, and once they are not ready because they are kind of more into drugs, and this number is increasing, right, over every day, I would say. And unfortunately, due to the laxity in terms of prescription medications, what as medical professionals we are prescribing, and the expectations from the patients. So I think there is definitely a lot of complexity going on beyond that. Once we prescribe somebody for a short period of time, again, the pain tolerance has gone down. So they are kind of getting more and easily addicted to that. So how do you think that is there a solution to it? Or, I mean, at least we can start talking about it.
Yeah, no, absolutely. Again, and that's really concerning. Again, as I would say, I just mentioned that. So let's talk about a little bit about numbers, just to see how bad the situation is.
Hmm.
So the problem is 1 in 8 teenagers, they have abused a drug. Like that's a very high number. That's an extremely high number. Almost 13% of the teenagers have abused drug over the last year. That's a really high number.
That's starting from late middle school or high
Yeah,
schoolers.
that's actually 15, 12 to 17 age group. So
Okay.
there's certain data on 15 to 25, but this is from 12 to 17. So that's the most vulnerable age. Again, we all know that the teenagers, they're living in the present. They don't really see the past, and they unfortunately cannot really look into the future. So in simple words, they don't care what's going to happen if they
Right.
continue to do that. So 1 in 8, that's a very high number. 13% of this age group, that's an extremely high number. The problem is, if you look at the data, the overall deaths amongst the teenager from opioid overdose have gone up significantly. Overall in adults, it has gone up, but in youth. And the problem is that we have, again, as you mentioned, that we are seeing more and more synthetic opioids, and on the top comes fentanyl. So fentanyl is, it's 50 to 100 times stronger. 50 to 100 times, that's a big number. It's 100 times stronger than morphine. Just imagine
Wow.
that, heroin is 10 times stronger than morphine. So what it does, we all know that, right? But the problem is 100 times stronger than morphine. That's really significant. If you combine that with benzodiazepine, that's why they have the slogan, one pill can kill. That's how it happens. And the problem is that once they're into it, they develop tolerance. So that means, again, that's another criteria to see if the dependence has actually transformed into abuse. So once they have increased tolerance, same dose is not going to work. So patients start taking up to, even instead of like 2 or 3 pills, they start taking 15, 20 pills a day. And sometimes when they, try to go cold turkey, that means, they just stop taking it without any assisted treatment. Maybe after 1 month or 2 months, when they relapse, and then they take the same number of pills, even half of it, even one third of it, one fourth of it, they can die.
Wow. And these numbers are very alarming because fentanyl and all these drugs, what you mentioned, most of the time in the ER we use for moderate sedation, put somebody in sleep for any procedures. but that's done under medical supervision with a lot of care and concern. And if somebody is using the same drugs off the street at home without any supervision, that's kind of a big red flag. So let me switch to you, Imam Sajid. Always curious to know, uh, is there a data or is how do you see the difference when family is more involved? I'm coming to the upbringing part of it, right?
Mm,
So if there is a strong family bonds
mm,
and if there is a parental care,
mhm,
if the parents are more involved with their kids and the overall like extended family, so once there is a close-knit connections, have you seen any difference between those kids versus kids coming from a single parent background? Are they kind of more prone to kind of addiction because of lack of parental supervision versus they kind of grow up as a strong adult that they can resist to these cravings?
yeah. Uh, Absolutely. I think there's actually research that's out there that shows that when there is what they call an authoritative
Mm.
dynamic between a parent and a child, which is not an authoritarian relationship
Mhm.
where you're just kind of told, but it's authoritative, right? There's clear demarcations of boundaries and limitations, what's okay, what's not. But there's also love, compassion. There's a relationship back and forth. There's a give and take, and
Right.
there's conversation. You know, I want to go out at night with my friends. Okay, let's talk about it instead of saying nope, you're not allowed to. So that's authoritarian versus authoritative. It's I think there's research out there that says I was actually reading a paper that says that authoritative relationship with the parent and the family dynamic has served as a deterrent for children getting into addictions and abuse and behavioral issues or whatever it may be. So absolutely, even Islam talks about the companionship in the Hadith of Prophet ﷺ. It is better to be alone than with poor company, but it's even better to be with good company than being alone,
Got it.
right? To be isolated is a very dangerous place to be. Good company is the best of companies. So when there's a healthy family dynamic, I think it definitely becomes a mode of setting expectations and then obviously the modeling behavior of parents, right? The parents are people that are into drugs or alcohol or cigarettes, then the likelihood of the child modeling that behavior spikes versus if the parents are modeling better behavior. So I absolutely think yes, the relationship of a parent and and the family dynamic having a robust and good family environment does uh, help in terms of
Got it.
preventing these
So
addictions.
the support system that comes from the family, more important, more importantly from parents, I would say,
Yeah.
right? And as you have demarcated between authoritarian and authoritative, right? So I think that just itself is a normal parenting, right? As a parent, you're
Yeah.
concerned, but you have a lot of, I would call as empathy and love towards your child.
Mm-hmm.
So you want to be kind of strict, but I mean, strict might not be the right term to use,
Sure.
but I think you want to kind of protect your
Yeah.
kid
Yes.
and make sure he develops or he nurtures his habit in a
Mm.
very controlled environment. Because as you're growing, sometimes you're not as wise as your parents are
Mm-hmm.
because they
Of
have
course.
seen more world and more
Absolutely.
experience. So I
Absolutely.
think that's a very good point. Coming back to you, Dr. Khan, as a family, right? You have teenagers, you have young kids in your family and you see some shift or change in behaviors. And partly it could be that, again, there's a puberty part involved, and now he's growing as a young adult. Now that he's coming up with his own behavior, own thoughts. There is some sort of kind of rebellious nature, which is kind of good to have. But at what point a family should get concerned? What behaviors or red flags, signs, symptoms, or however you like to call?
Yeah, Jazakallah khair for the question. Extremely important as a parent, and even for us, as physicians. So let me touch base a little bit on the clinical criteria. And again, I'm just going to try to make sure that it's a simpler version, for our viewers.
Definitely.
So the substance use disorder, opioid use disorder. So the clinical criteria involves that if there's a persistent, recurrent, repetitive use of substance which is leading to consequences involving in, let's say, the patient is not doing so good at work, at school, at home, and also if he stops taking the substance goes into withdrawal. So withdrawal symptoms, again, nasal congestion, runny nose, tremors, bone pain, all of those withdrawal symptoms. And the patient has developed tolerance, which means that patient needs more and more of that substance
Hmm.
to maintain the same symptoms that he was experiencing or she was experiencing in the past. And so tolerance is part of that as well. And the patient has multiple relapses, in between. So that's kind of like the clinical criteria for that. But as parent, again, if you think that, what, everything is just not right. My child is not taking part, was going to the mosque very regularly. All of a sudden, something happened and he's just not doing it, just not doing his homework, just not interested in spending time with the family or the friends, and just is very different. So, all those changes, you're not going to see those kind of changes, when the teenager is going through the pubertal stage.
Right.
So that's different. So, and again, if there are any of the red flags, most important thing is talk to them, talk to them, talk to them. So make sure, please make sure, as parent, we talk to our children about what's going on. It's extremely important.
And I assume, like, once you start that conversation, a dialogue, if they are facing those challenges, I'm sure uh, they'll be honest in terms of what they were going through and if they are kind of using any illicit substances. So, I mean, as a parent, I think me as a parent, always try to kind of emphasize and force myself that no, this communication has to go on. It's a bi-directional, I would say. Uh, and how society we look at these substance abuse or somebody who is addicted to drugs, we kind of probably try to look down upon these people, right? And there is a lot of stigma associated around it. So let me come up with a hypothetical example, right?
Mm-hmm.
Somebody who is kind of reputed in the society, and suddenly his son or a daughter is facing through these issues. So they are probably more concerned to come up to a physician or to an imam and express their concern and seek a consult or help. Uh, because if this issue gets out in the society,
Mm-hmm.
then there would be consequences.
Mm-hmm.
Definitely, it's a reputation of the family involved. There is long-term consequences because they still have to survive in the society.
Mm-hmm.
So, what's your take? Like, how should we deal with it as a community?
Yeah, you're absolutely right. There's this like reputation issue, right? And then, so there's this shaming, right? That the community, the families will feel and their embarrassment. And so that becomes a huge hindrance. Actually, I don't say it's a small, it's actually a major hindrance for people to come forward and talk. And I often remind my community about this concept of amana, right? The Prophet ﷺ was recognized as a Sadiq al-Amin before even Rasulullah, right? Even before his prophet, he was known as trustworthy. Amana, confidentiality, being there for people and protecting them, right? As an ummah, I think we've kind of strayed away from that. We've kind of, because of the stigma around it, we've started to embarrass people and shame people. Yes, there is an element of it, but Islamic function around these things was that people were never, if there was accountability, or there was punishment or had, whatever you want to call it, they were reintroduced back into society and they were dealt with as normal citizens again. So when they were caught drinking, they were caught doing something that was inappropriate, they were again reintroduced back into society. That's the Islamic judicial system, is that they become functioning individuals back into society after they get the treatment, the help, and they
Yeah,
stop what they're doing.
definitely.
So they're not stigmatized, they're not embarrassed for it, they're not beaten down for it. And I think we need to go back in whatever spaces that we work in, is to kind of open that conversation and let people know that, look, we are very confident. I know, like, my protocol when I meet with people going through whatever, when I'm counseling couples or family members or whoever it may be, the first thing I actually have is I let them know about the confidence in this room. It's not gonna impact how I see you, how I interact with you, and nobody's gonna find out. It's gonna be very confident. It's between us and the individual sitting in this room. So I think that allows people to kind of open up, because and then people don't use resources.
Definitely.
Families are embarrassed to use resources around it. Alhamdulillah, we have, trained physicians and people in these immense resources. We have amazing resources, alhamdulillah. But again, the community either doesn't know, or they're kind of embarrassed to use their resources because of that stigma. And I often tell people is that, it's not reaching out, and as imams, we're kind of often the first responder. We're not the solution. We don't know and how to, from a medical practitioner's perspective, how to rehabilitate a person off a certain drug. But what we can do is at least we can be a first responder and kind of gain the trust, and then we can
Pass
give
it
them
on.
to a resource. And I think leadership should know about be aware of all the resources within the community, and then kind of pass them on. But yes, it is a big hindrance. The stigma
Yeah,
is
I think
embarrassing.
as a community, you mentioned a very good point. We have to be more tolerant. We have to be
Yeah.
more receptive, and kind of we should not look like on few problems,
No.
like for example, mental health issues, addiction issues,
No.
as something as completely total out of the world, right? It should be as normal as blood pressure, diabetes, right? And it's okay to have that problem, but it's more important to kind of deal with the problem and kind of, as you mentioned rightly, bring that person back into the society
Yeah.
because that person is more important. So we should probably look down upon the problem, not the person,
Exactly.
if I'm right, right?
Exactly.
And so, uh, Dr. Khan, you mentioned about the prevalence in society in general. Like, I want to come back more specific to the South Asian population, or if I would, it's better to say more Muslim population.
Sure.
So, is there like a similar prevalence? Is it less, more? Because as a Muslim community, we try to brush things under the carpet, right? We don't talk about it until like something gets very serious. They end up in a serious problem. And again, part of the problem is, stigma dealing around with it and some of their own challenges. So how do you see as a physician are like more South Asian kids, Muslim kids coming to you?
Again, excellent question, but I'm really concerned about this as well. A lot of that has to do with, as Imam Sab said, that we should be open to our kids about it, and we should not be embarrassed to talk about this issue with our kids. The
Sure.
kids should not feel embarrassed about it, and the parents, should admit that. And again, as we mentioned, that as a patient, they will have full confidentiality. That's our job, that's our responsibility.
HIPAA compliance, right?
Absolutely,
Something we have in
absolutely.
medical terms.
And especially in this particular field, we make sure. So it's a mental health disorder. It's a mental health condition which requires treatment. Of course, it can start with, let's say, occasional recreational use, and then it might transform into dependency, and then at some point, it will become opioid use disorder, substance use disorder. But again, at that point, what we need the parents to do is go into the admittance phase. If you're not admitting something, if you're not admitting this as a fact, this happened, and the child needs treatment, nothing can happen because again, they have to give the consent for the treatment. Again, we are talking about the teenagers. Of course, afterwards things change a little bit. And as Imam Sahib, as you mentioned, extremely important that the parents should have a strong connection with the kids. And subhanallah, I'm so happy that I learned about the whole incident that you explained about that person in the era of Prophet Muhammad sallallahu alaihi wasallam, the way he dealt with things. And if you actually, I'm going to sidetrack a little bit and then come back to this question. So if you look at there are certain clinics and treatment centers, so they have certain criteria that, okay, well, you fail one drug screen and you're done. And, they're going to kick out of the program. And then, those patients either relapse or they look for like another doctor. But here, we have the Sunnah. And again, if you look at the American Society of Addiction Medicine guidelines, ASAM guidelines, again, my board comes under that. So if you look at those guidelines, they actually follow the Sunnah, which is, again, you have to have a strong connection with the patient as well. And you need to realize it's a chronic remitting and relapsing disease. That's what I tell the patients. Hey, that doesn't mean you're gonna get unlimited chances, but drug screen is one thing, but you should tell me, we should have such a strong patient-physician relationship. There should be trust involved in that. So sometimes it has happened that, patients have had normal drug screens. They were not due for that. Just after like 3 to 5 days, they call the clinic, hey, I'm sorry, I just wanted to let you know this happened. And I help them out. So alhamdulillah, so there's a way to deal with things.
Eventually, we are humans at the end of the day,
Exactly.
right? We are not angels.
Exactly.
Yeah.
But very important, we should remove the stigma. One of my patient actually, and we'll talk about the treatment at the end as well, but she went to the pharmacy to pick up the prescription, and the pharmacy technician, who's not a pharmacist, with all due respect, is not a physician. So they're dispensing, and the patient actually went with the kids. So they were looking at the patient in a different way, and then actually they commented that you should not have brought the kids to the pharmacy to pick up this prescription, which was the treatment for the opioid use disorder, right? So you can imagine that what kind of like psychological trauma that patient slash mom would have to go through in front of her
Her
kids.
kids.
So coming back to the Muslim community, I would strongly urge the people out there, our Muslim brothers and sisters out there, the parents, you have to, again, if there's an issue, you have to be open to the kids about it. You cannot be, again, Jazakallah for mentioning that. That's a huge difference. You cannot just fix things by enforcing the rules. You have to get help. And then when they're in the treatment, please, you have to pat on the back as well. You cannot just say that, oh, well, you know what, and you're always like doubting them and always like, we have to make sure, I'm just giving an example just lastly that, a patient came in and, I talked to the dad and, since we talked about the ethnicity, so the patient just mentioned that, even if I go to the moon, my dad is going to say that, not a big deal, it took you so long, So that was the trust that he had on his dad. So we have to change that mentality, and we have to be open. Sometimes when I see patients, let's say, of other ethnicities, I'm talking to Mr. John Doe, and the dad says, "Okay, Dr. Khan, all right, well, you're good to go. Well, you can join us." No, I trust you. I trust you. Thank you, Dr. Khan, for doing that. And John Doe is doing perfectly fine. With the certain community, when I deal with that situation, parents are there, which I appreciate. First 2-3 appointments, but then they're like really, and they're even hiding the medication from the patient, that maybe he's just not taking it on time, and maybe he's just doing something, and we have to make sure that he like puts it under the tongue, and yeah, there has to be trust involved in that.
Yeah.
You have to change the approach. It's
So
otherwise it's
for
not going to
parents,
work.
they have to be like more accommodating. They have to be more understanding, and don't expect your kids to be angels, because we are not angels to start with, right?
Absolutely.